Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. What impacts will the Department of Veterans Affairs and veterans see if the government shuts down? There are specific things within the government shutdown that will absolutely impact the Department of Veterans Affairs. Now, how does that translate over to you individually? Well, it depends, right? It depends where you're at. Like I say, there's always so much nuance in all of this. So I wanted to just jump through it, share with you an article later, but first, from the Department of Veterans Affairs, the contingency plan and what impacts we will see from a what's impacted to a what's not impacted, and then we'll jump into a little article as well. So with that, hit the thumbs up for me, subscribe, share with a friend, all that good stuff. I truly appreciate it. Every thumbs up, every minute watched really does help expand the reach, which is really what we're trying to do. It takes all of us. So with that, let's jump into it. On the Department of Veterans Affairs website, there is a VA contingency planning page. I'll try to remember to put this in the link. Or put the link in the description. The Department of Veterans Affairs estimates 97% of VA employees continue to work during a shutdown. So that's good news for us. So 97% continue to work during a shutdown. According to the VA Human Capital Contingency Plan, VA is committed to providing quality, consistent care and services to veterans, families, caregivers, and survivors. VA's mission allows no exception to this standard, even when operations are limited by the absence of appropriations, commonly known as a government shutdown. All right, so in this contingency plan, it's basically kind of like a one-pager with a what's impacted, what's not impacted. So what is impacted? There are 3, 6, 7, 8, I think, 8 or 9 bullet points, something like that, here that is the impacted areas of the VA. Impacted, here we go. 1, or bullet point 1, whatever. VA will cease providing transition program assistance and counseling for careers. So no career counseling, and they will cease providing transition program assistance. Number 2, call centers. VA's GI Bill, the 1888 GI Bill 1, and National Cemetery Applicant Assistance Number hotlines will both be closed. Number 3, VA benefits regional offices will be closed. Now, I've read before in other areas that it's closed to the public, but there's still, if you have 97% of your workforce still working, chances are there'll still be people in those offices. So the VA benefits regional offices will be closed. Next bullet point here is public affairs and outreach to veterans will cease, including social media, vet resource emails, and responses to press inquiries. Next one, no grounds maintenance or placement of permanent headstones at VA cemeteries. I think that's a sad one, actually. So that's impacted. So no grounds maintenance at the cemeteries and the national cemeteries, and no placement of permanent headstones at VA cemeteries. Now remember, just a side note, there's the national VA cemeteries that are under the National Cemetery Administration. Then in the individual states, as far as I know, at least the lion's share, but maybe all states have a state cemetery program for veterans. So state cemeteries, and those state cemeteries essentially mirror the look and feel of the national cemeteries, and they also get funding from that. So I would think those state ones would not be impacted because it's state. All right, so let's move on. Applications for pre-need burial at VA cemeteries will not be processed. Next bullet, no printing of new presidential memorial certificates. For those that don't know, if you have a loved one who had passed, it could be a great-grandfather, for example, you can order a presidential memorial certificate, and you can order as many as you'd like. You can order, 15 of them if you wanted to, because you want to give them to different family members. Next one and last one here for the impacted areas for VA. No outreach to state, county, tribal, municipal, faith-based, and community-based partners by VA Central Office. All right, so what is not impacted? There are 6 bullet points here. VA medical centers, outpatient clinics, and vet centers will be open as usual and providing all services. So your medical care is taken care of. VA benefits will continue to be processed and delivered, including compensation, pension, education, and housing benefits. These will all continue being processed and delivered for you, so you don't have to worry about that. Next bullet point here, burials will continue at VA national cemeteries. Applications for headstones, markers, and burial benefits processing will continue. Next one, the Board of Veterans Appeals will continue decisions on veterans cases. Call centers for VA's primary call center at 1-800-MY-VA411 and the Veterans Crisis Line, which is 988 press 1, will remain open 24 hours a day, 7 days a week. And the last one here, suicide prevention programs, homeless services, and caregiver support will continue. All right, so now let's shift over to the article. The headline is Veteran Groups Warn Congress Against Shutdown, Resist the Pool of Political Brinkmanship. All right, so this just came out, obviously, with the shutdown on the doorstep here. Several veteran groups are urging Congress to pass a short-term spending measure to avert a potential government shutdown, warning that GOP-led continuing resolution, the CR, continuing resolution, contains extensions vital for veterans' housing, benefits, and health care. All right, so they are basically saying that, look, in this continuing resolution that's been put forth, it contains extensions vital for veterans, housing, benefits, and health care. For the number 4, veteran groups, American Legion, AMVETS, which is American Veterans, Vietnam Veterans of America, and Mission Roll Call, said on Saturday that the CR, continuing resolution, which passed the House earlier this month, contains vital extensions for the Department of Veterans Affairs that safeguard important programs. Now, that is, important to understand that including these important programs that would also include the Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program, the Healthcare for Homeless Veterans Program, and the Supportive Services for Veterans Families Programs, SSVF. Congress must act without delay to pass this measure and ensure the VA can continue delivering life-saving services to veterans and their families. AMVETS told The Hill in a statement, looking ahead, AMVET encourages Congress to prioritize timely full-year appropriations to provide the VA with the stability and predictability needed to best serve our nation's veterans. Republican and Democrat leadership appear far apart from reaching a consensus to pass the CR and avoid a potential shutdown slated to kick in after midnight Tuesday, the 30th of September, which is today. Senate Minority Leader Chuck Schumer and House Democrat Leader Hakeem Jeffries each said they will not vote for the House-passed short-term spending measure. Some other Democrats within the conference are looking at other ways to avoid the shutdown on September 30th. Senator Shaheen, who plans to retire in late 2026, has sent out feelers to GOP lawmakers about reaching a potential deal. She has not ruled out voting for the CR. On Thursday, Senate Majority Leader John Thune said Congress should avoid a shutdown could avoid a shutdown if Democrats scale back their demands to add about $1.2 trillion in healthcare-related spending to the CR. With President Trump turning down a request from Schumer and Jeffries to negotiate, Democrats are left with few options, but none are ideal for the party currently in the minority in both chambers. GOP senators will need backing from at least 8 Democrats to advance the bill, considering Senator Rand Paul said he will not support the CR. Every day of a delay caused by partisan conflicts means veterans remain on the streets, families wait for benefit decisions, and momentum toward solving the suicide crisis is lost, Vietnam Veterans of America told The Hill. I appeal to both of you as leaders of your caucuses to resist the pull of political brinkmanship and work together with the president to keep the government open, the group statement continued, likely referring to Schumer and Jeffries. Senate Democrats are reportedly holding a conference call on, they reportedly had this conference call on Sunday the 4th to talk about the shutdown strategy. If the government shuts down next week, or this week, actually, veterans will still be able to get their pensions and disability payments. The 24-hour Veterans Crisis Line would still work, and VA hospitals would remain open. But other services would halt temporarily, including the GI Bill hotline, VA benefits regional offices, and some others. These extensions are not simply bureaucratic measures. They directly affect the lives of veterans and their families. The American Legion, a veterans organization with over 1.6 million members, said in a statement. With that concludes it. Thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.